All right, well, it is Menopause Awareness Month, and it is something very significant that affects more than 1 million women a year.
And it can be a lot to process. So Dr. Heather Johnson, an OBGYN, joining us this morning to sort of help those going through it, you know, with the whole process of it. Good morning.
Good morning.
So get us started, kind of explain to folks, we can't take for granted, kind of go back to the 101 version. What is menopause? How do you identify if you are experiencing it?
Okay, well, menopause is literally the pause of menses. It's the very last menstrual period. And you don't know about that until a year later because you go for a year without periods. The average age in this country is 48 to 52 of people going through menopause. And there are some signs and symptoms that go with it that make people sometimes very uncomfortable with it.
Talk about those signs and symptoms.
The most common one is hot flashes and night sweats. Everybody's heard about that. And for fortunately many women, it's just a little bit of discomfort. But for a good chunk of women, they really suffer. They don't sleep at night, they're changing their clothes real often, their heart is pounding. It's almost like a panic attack for some of them. And it's very disruptive, which can lead to then fatigue, insomnia, mood swings, anxiety, all those sorts of things.
So what are some of the ways, maybe some of the more common ways to manage those symptoms?
Well, we always start with the, lifestyle. It's very important, and making sure that you get rest if you can, making sure you drink lots and lots of liquids, making sure that your nutrition is sound, relaxation, exercise, all of those things will help you be better so that when you have this additional stress, it's easier. There are a number of over-the-counter things that people use that work. And there are going to be some people who really have to take medication for it in order to get through it. It could be that it only lasts for a few months, but sometimes people suffer from the symptoms for 6 months, 12 months, 1 or 2 years.
Oh boy, okay.
Got you. And we've come a long way in terms of sort of how we talk about menopause, talking about it at all. Are you seeing that in sort of how women are experiencing it, or is there still a lot of stigma or just even misinformation and not fully understanding it?
Yes and no.
Okay.
I got interested in menopause a few decades ago, and I joined what was then called the North American Menopause Society. And I was coming home from a conference and had a little canvas bag, and it said North American Menopause, and I was on the metro, and a woman looked over at me and said, "How dare you bring that out in public?" And I thought, it's not a four-letter word. Right.
Wow.
So it was synonymous with old, dried up, just it was not something people talked about. Maybe 10 or 15 years ago, we started getting more information, and residency programs and things are slowly catching up and teaching people about it. Pretty much the advice you got before was, you'll be fine.
Right.
Just get through it. Most of it's in your mind, and it's not. It's a real life-altering time.
Absolutely.
Okay. So for people who do want to learn more and want to get more resources or just find more information, tell us how they can do that.
So the National Menopause Foundation is a good source for lay people. You know, I'm a member of the American College of Obstetricians and Gynecologists, but that's more for people who are trained in that. But the National Menopause Foundation has all kinds of, it's a fabulous website. It has all kinds of courses and classes that you can take online, in person, or on your own, that will help with all of those things. They have a checklist of about 30 different symptoms that are associated with menopause and things that you can do about it.
Okay.
Wow. Thank you so much, Dr. Johnson.
We do have that website on the screen, nationalmenopausefoundation.org.
Yes.
Thank you so much.
Thank you.
We appreciate you sharing your time. All right.